Hirsch, and welcome to my channel, Health by Heather Hirsch. Here is where we talk about all things menopause and midlife. I am the lead physician of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where it is my passion to improve the care and knowledge on all things women's health, particularly at midlife. Today, I want to talk about one of my favorite over-the-counter products for stress incontinence. And I wanted to talk about this because, well, really, we're still in the midst of the COVID pandemic. And because of that, we need to take advantage of over-the-counter options since a lot of us are making runs to CVS or Walgreens or whatever our local pharmacy is. It's one of the only things that's open. Before we get into my favorite product, I just want to go over the difference between stress and urge incontinence. I want to go over my product at the end, tell you some things that you can do to improve this incontinence at home by yourself, because it's a societal myth that we, as we age, just get older and leak urine and have to wear pads our whole lives. And I really, really want to disrupt that trend. So let's talk about the difference between stress and urge incontinence. Stress incontinence is sort of what it sounds like. If there's a stressor, you leak urine. So examples might be sneezing, coughing, or jumping. So if you think of jumping on a trampoline and immediately you think about having an accident or leaking urine, that is stress incontinence. Urge incontinence, on the other hand, is the gotta go, but can't get to the bathroom fast enough type of incontinence. It can be both are really quite disruptive to your quality of life. And I have had plenty of patients tell me that this has disrupted travel plans. They're worried about being stuck on an airplane, being in a place where they don't know where the bathrooms are, or even something simple like going to the movie, because if you laugh in a movie and happen to leak urine, you can't get to the bathroom, and that can just totally disrupt your date night essentially. So mixed incontinence is when you have a combination of the two, and there's also overactive bladder, and there's a couple other different types of things. So stress and urge tend to be sort of just like the main buckets, at least the way my brain functions. So what can you do about it? Well, what a lot of women do, and I ask this of almost all my patients who come to see me in the office, if they have any leakage, is they wear liners. So, you know, I definitely know it's a popular option, but I really want to tell you some reasons why I want to move you off of liners. Number one, it's great marketing. They want you to wear liners from your first period to forever if they can. Kind of the same thing with diapers. They just want to keep us all wearing some kind of protective measure. Now, the purpose of underwear is to protect your pants. The purpose of a liner is to protect your underwear. Now, I get it. If it's wet, that's uncomfortable. But liners can be quite irritating for two big reasons. One, they can irritate the labia. So they can get the labia can become really red and more atrophied and irritated because of just constant friction with the liner if you're always wearing one, particularly if your main reason is insurance. I hear this a lot. I wear it just in case, but most of the time there's no leakage or I'm not wet. So get rid of the liner. I want to free you of the liner. Liners can also be sort of like breeding grounds for yeast infection or BV, which is bacterial vaginosis, another thing you don't want. So again, I really want you to try to get rid of the liners. So what can you do? Well, you can bring another pair of underwear with you. I know this sounds incredibly awkward, but yes, you can bring sort of a backup pair of underwear in case you do have some leakage. You can go to the bathroom and change into a new pair, and pants are still nice and protected. There is a pair of underwear, a brand that I really love, not sponsored, and I'm not an affiliate. It's called Dear Kate, and they have sort of this wicking material. So if you just have a dabble, it might wick it away and you might never even know. So they're really, really convenient. You can check those out at dearkate.com. So that's one nice option as well. Now, if you have a lot of leakage, then you probably should see either your gynecologist or a bladder specialist like a urogynecologist, because if you're having so much leakage that you need to wear a pad every day and it's always wet, that's a sign that you might need something a little bit more. All right, what is my favorite over-the-counter product? It is this. It is called Poise Impressa. Poise Impressa is essentially a disposable pessary and like tampon in kind of combined in one. So if you don't know what a pessary is a small ring-shaped device, probably about this big, and it goes up behind the cervix and kind of helps to hold up the bladder so that you don't leak. Pessaries are great. They're a really great option. But for some women, they don't need them all the time, or they don't want a pessary. They don't want to have to put it in and take it out, although they can be left in for up to 3 months. So this is sort of a disposable option. So who's this good for? This is really great for the person who, you know, is a runner and knows every time they go running, they leak urine, so they wear pads or they wear liners. This would be a much better option. Or if you are leaking urine because you're sick and all of a sudden you're coughing a lot, again, I really like the Poise Impressa over the liners. Yes, it is also a Band-Aid if that's what you're thinking, but it's going to avoid irritating the labia, and it's also going to not be so much of like a increased risk for bacterial vaginosis infection if you change it regularly. It comes in this, the starter pack has 3 different sizes so that you can figure out which size that you use, and I really, really, really like it. So you can get these over the counter at CVS, or you can probably get them on Amazon. So this is what the box looks like. Okay, so what causes urinary leakage, especially as we get older? So there's kind of a couple of different reasons. The first is weight gain, or this could also be, you know, if you think about pregnancy, when you had that big belly, that, you know, the baby sitting on top of the bladder, anything that's causing pressure on top of that bladder, whether it's a baby or whether it's weight gain, it's just added stress that's causing the bladder to leak urine. So that means, yep, definitely kind of keep your weight in check and monitor, and sort of if you notice it's going in the same direction as your weight gain, that could be something to just sort of watch out for. There's, of course, hormonal changes. Now, as you go through menopause, you lose estrogen. Estrogen can have a big role in connective tissue, in you know, in tissue integrity and tissue strength, and so we lose that estrogen, and so that can play a role in it, as well as changes in muscle and muscle atrophy. You know, just like any other muscle, like your bicep here, if you don't use it, you lose it. So Kegel exercises, you know, we've always talked about them. We all know what they are. They can be helpful. If you have significant urinary leakage, you're not yet ready for an invasive procedure, you don't want a pessary, I highly recommend pelvic floor physical therapy. They're going to help you learn how to retrain and reuse those muscles that you really haven't been using for quite some time. There's also neurological issues. Neurological issues can definitely cause bladder leakage. If that's you, you probably know you might have a very specific neurologic diagnosis. And those are some of the main reasons that women get urinary leakage. Now, I want to be here to disrupt the social norm. You don't have to age and just simply leak urine and wear pads and liners the rest of your lives. There's definitely things that you can do. Knowledge is power. So knowing the reasons why the urinary leakage can happen are really important. Again, that's weight changes, hormonal changes, muscular or other structural changes such as difficult deliveries in your past, and neurologic issues. Those are main reasons. Starting with over-the-counter things, ditching the liners, trying something like maybe Poise Impressa. Again, I recommend these to my patients a lot. Thinking about pelvic floor physical therapy, bringing a separate change of underwear if you do have any leaks or accidents during the day, and if it's really, really, really a significant problem where you really need a heavy pad, you should definitely be seeing a urogynecologist to go over with you either pessaries or more invasive things like procedures or surgeries. So not giving direct medical advice, but I just wanted to give you an option while we're all still quarantined for things that you can do while you are at home. I hope you guys liked this video. If you did, please subscribe. That lets me know you like this type of content. I should keep making these videos, and it really helps me out just to know what you guys like. Send me any comments or questions, and you can also check out some more of my products down below. Thanks, guys. Stay safe. Stay home.